5 insights from the AP series on health inequalities affecting Black Americans. The Associated Press spent a year investigating how racial disparities in health have harmed generations of Black Americans. From birth to death, Black Americans fare worse than whites in terms of health. They have higher rates of infant and maternal mortality, higher rates of childhood asthma, more difficulty managing mental illness as teenagers, and higher rates of high blood pressure, Alzheimer's disease, and other conditions as adults. According to the Centers for Disease Control and Prevention, Black women have the highest maternal mortality rate in the United States, 69.9 deaths per 100,000 live births in 2021, nearly 3 times the rate for white women. The 2021 rate represents a significant increase over last year. Black babies are also more likely to die and are more likely to be born prematurely, setting the stage for health problems that can follow them throughout life. In 2020, there will be 364,487 premature births across the country, accounting for about 1/10. Black babies had the highest rate of premature births between 2018 and 2020 at 14.2%. Several factors contribute to these inequalities, such as underlying health conditions, according to the CDC and advocacy groups. But a growing number of doctors and experts are pointing to the role of structural racism in driving unequal access to healthcare, implicit bias, and discriminatory care. Poor healthcare or poor outcomes for Black mothers can in turn cause problems for their children and put them at risk for future health problems. Black children are at higher risk for asthma and exposure to certain triggers such as mold and air pollution. Their asthma is usually more severe and poorly controlled. Approximately 4 million children in the United States have asthma. Black children suffer from asthma at much higher rates than white children. Nationally, more than 12% of Black children have the condition, compared with 5% of white children. High asthma rates in some Black children are inherited, families of allergies and frequent respiratory infections, but much of that inequality stems from the same racial factors that affect the health of Black people from birth to death. When it comes to asthma, especially in children, where you live is very important. Where you live usually depends on your ethnicity. Black Americans are at higher risk of living in homes with asthma triggers such as cockroaches, dust mites, mold, and rodents. Studies also show that air pollution can make asthma worse. Nearly 4 in 10 Black children in the United States live in areas with poor environmental and health conditions, compared with 1 in 10 white children. Factories emit nitrogen oxides and particulate matter. Idling trucks and highway traffic create toxic fumes and dust. Inequality is built into a housing system shaped by the long-term effects of slavery and Jim Crow-era laws. Many of the same neighborhoods with substandard housing or proximity to toxic sites today are the same ones that were segregated decades ago. About 50% of Black youth experienced moderate to severe depressive symptoms, and about 18% reported experiencing racial trauma often or very frequently in their lives. The triggers for Black children's mental health crisis begin early and last throughout life. Black children's first exposure to racism can begin before they start school, with Black teens reporting experiencing racism an average of 5 times a day. Young Black students were often seen as less innocent and older than their age, leading to harsher discipline in schools. Black youth are significantly less likely than their white peers to seek and find mental health care. This is partly because Black families often distrust the healthcare system after suffering generations of abuse, from lack of access to care to racist practices and experiments. The country also lacks providers who understand the role of racial identity and racism in shaping the mental health of young Black people. Research and health monitoring data show that Black adolescents have been experiencing a growing psychological crisis for decades. Between 1991 and 2019, the rate of suicide attempts among Black youths increased more than any other group, nearly 80%. High blood pressure played a significant role in COVID deaths, especially in Blacks. Together, they created a deadly combination. While it was associated with 15.5% of white COVID deaths, the figure was 21.4% for Black victims, the highest of any racial group. About 56% of Black adults have high blood pressure, compared with 48% of whites. 3 out of 4 African Americans may develop the disease by age 55. While only 32% of white adults with high blood pressure had their condition controlled with medication, the rate was even lower for Black Americans at 25%. By 2060, the number of Americans with cardiovascular disease is projected to increase dramatically. The prevalence of high blood pressure alone is projected to increase by 27.2%, or from approximately 127.8 million to 162.5 million Americans. Among whites, the prevalence of cardiovascular risk factors and diseases is expected to decrease over time. Still, people of color, especially blacks and Hispanics, are expected to see significant increases. As with many diseases, genetics also play a role. Experts also blame poor diet, high cholesterol, obesity and smoking, risk factors that tend to be more common in black communities. Moreover, in recent years, more and more scientists and doctors have begun to focus on structural inequalities with outsized consequences. Black communities are more likely to lack access to healthy food or be overwhelmed by fast food options. Black Americans are more likely to develop Alzheimer's than whites. About 14% of Black Americans over the age of 65 have Alzheimer's disease, compared with 10% of white Americans, according to the Centers for Disease Control and Prevention. Experts think rates could be even higher. Health problems such as cardiovascular disease and diabetes that develop early in life are well-known risk factors, both of which are more common in Black and Hispanic populations. Depression, high blood pressure, obesity and chronic stress are also risk factors. The CDC also identified the effects of higher poverty rates and greater exposure to adversity and discrimination as risk factors. In general, blacks are also less likely to receive the same health care as whites, including necessary medications for Alzheimer's and dementia-related diseases. A preliminary study released this year by researchers at Mount Sinai found that blacks are less likely than whites to receive dementia medication. Black and Hispanic populations are expected to increase in the coming years, as will cases of Alzheimer's and related diseases. Cases among Black Americans are projected to increase fourfold, and Hispanics could increase sevenfold compared with today's estimates, according to the CDC. Some proponents estimate that by 2030, nearly 40% of all Americans with Alzheimer's could be Black or Hispanic. However, the projected increase in cases is not solely related to population growth. While there is evidence that certain genetic risk factors vary by race and may be triggers, the large differences between racial groups cannot be explained by genetics alone, experts say. The sheer trauma of experiencing racism has also been identified as a contributing factor. To support our channel's growth and ensure broader awareness, kindly hit the like and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.